Okay, let's just start with the session. So, for last two sessions, I had been dealing with national public health programs under the Ministry of Health and Family Welfare. So, this session is all about National AIDS Control Program. My screen is visible.
Yes, sir, you're visible.
Okay, thank you. So, in this session, we will be talking in detail about National AIDS Control Program. This program specifically deals with HIV/AIDS. Uh, so, this is one of the programs which is a vertical program. Government has been thinking of lately to merge this with other existing program, but somehow that has not happened. Because this disease is having so much of a stigma across the population. So in this session, we will learning in brief about the introduction of. I think someone is unmute. If you can mute yourself, please. Thank you. So in this program, we will be learning in brief what is NSAP, and then what is NACO, that is National AIDS Control Organization. What are the milestones of this program? And then there are multiple phases of NSAP. So that's how it has, over the period changed. NSAP phase 1, NSAP phase 2, phase 3, phase 4, and phase 5. Currently, we are in phase 5. So this phase manner started from 92, and then it has been going. And then what has changed across these phases? We will, in brief, we will be learning about that. So AIDS is a syndrome which is being caused by human immunodeficiency virus. Now, this virus basically attacks your immune system and it affects your immune. So you are the person who is having this virus, their immune system is compromised, and they get multiple diseases it because of this virus, because of being immunocompromised. And then that syndrome is known as AIDS, acquired immunodeficiency syndrome. And then ultimately the person dies because of those diseases, the diarrhea, be it pneumonia or be it something else. They never die because of HIV. HIV is the one which decreases their immunity, and because of they get other diseases. So in India, this first case was diagnosed in 1986 in a female sex worker in Chennai, and then subsequently they got a second case of this disease in Mumbai. So at present, Andhra Pradesh, Manipur, Maharashtra, Nagaland, Karnataka, and Tamil Nadu are hotspots. I will say they are hotspots because they have got very good screening system in these states. There are multiple states where they don't have that good, surveillance system or no or way to monitor these diseases. That's why they never got these diseases. Whereas the states which which we are talking about, they are hotspots because they have got good mechanism, good surveillance system, because of which they are getting more number of cases. So, Government of India formed National AIDS Control Committee, which is being headed by Union Health Secretary. And National AIDS Code Control Program was launched in 1987, just after an year when we identified first case of HIV in India. So NACO is the organization which works under Government of India and the Ministry of Health and Family Welfare. And the primary objective of NACO is to control the HIV epidemic in India. NACO also aims at facilitating and improving access to treatment for HIV people, and to promote the human rights of those people. So NACO, basically, if you will see across states, across districts, there are multiple ART centers. That is the place where HIV patients are being treated and they are being given free drugs. And then below ART centers, there are link ART centers, which is something like in many of the states, ART centers you will get at district level, and below ART centers, there are link ART centers. So basically, through ART centers, link ART centers, they have tried to reach to the doorstep of HIV patients, so that they don't have to travel a lot for getting HIV medicines.
Sir, your
Yeah.
PPT is not visible though.
Yes.
If you have a PPT on, your PPT is PowerPoint is not visible.
Okay. That's what I checked. You said that you can see my PP. Is it visible now?
Yes, now it's visible.
Okay, thank you. So, as I said, in 1986, the first case of HIV/AIDS was detected, and then in subsequent year 1987, NACO was formed, and in 1986, National AIDS Committee was being formed. 1987, NACO was formed, National AIDS Control Committee. Uh, then 2002, Government of India came up with National AIDS Control Policy, and then in the same year, they came up with National Blood Policy, which talks about how the blood donation has to go about, how blood banks will operate. So all these guidelines came in 2002. 2004, Government of India started ART treatment, that is antiretroviral treatment. 2006, National Council on AIDS came up under chairmanship of Prime Minister of India, and in the same year, pediatric ART started in India. So, if you will see the evolution of the program across the multiple years, so that's how it is. 1985, 86, 1985 to 1981, 86, the patient was identified. National AIDS Committee was formed in 86, 87. National AIDS Control Organization came up, and then after 87, 92, they came up with NSAP Phase 1. So NSAP Phase 1 continued from 1992 to 1999. NSAP Phase 3 from 99 to 2007, NSAP Phase 3 from 2007 to 2012, NICP 4 Phase 4 12 to 17. Then extension, they gave extension to NSAP 4, which was from 17 to 21, and then NSAP Phase 5 started in 2021, and currently we are in 2023. So it is supposed to continue till 2026. So NSAP Phase 1, what was the objective of that first phase? So first phase was to slow and prevent a spread of HIV through a measured effort to prevention transmission. So basically, NSAP Phase 1 targeted uh, was targeted towards prevention of transmission of HIV. So the strategies identified under this phase were to attain a satisfactory level of public awareness. So because things were still, in a research phase, they were about to learn things, uh, to know how it spreads, and also basically uh, we are still trying to find a drug so that a person gets fully cured from HIV, which has not uh, has happened till now, and we are still medicine, people are still doing research on that if they can come up with such a treatment, which has never happened till now. So NSAP Phase 1 main focus was on increasing the public awareness so that the transmission of HIV spread can be prevented, and then so that it can be slowed down further. And then the another strategy was to screen all blood units collected from blood transfusion. So those who have worked into a medical setup, they have came across certain cases where there had been examples of blood being uh, donated, blood being given to patients when bloods were not checked. They had been not screened. Multiple hemophilic cases I know who had been transfused blood without being checked, and uh, they were hemophilic, but ultimately they got HIV also. So that was the case when people were not aware much about this disease condition and they have transfused blood. So think about the menace which those people have to go through just because they got blood transfused. So another aim strategy was to decrease the practice of professional blood donation. So if you will go back in time, there had been donors. These donors where they were charging hefty money and they were giving their blood. And most of these blood donors were drug addicts. So they were giving money and they were using those money for uh, taking drugs. So government came up with a law where they made this blood donation voluntarily. They targeted this practice of professional blood donation, and then they came up with voluntary blood donation things and all. And one of the strategies was to strengthen and control of sexually transmitted disease and to monitor development of HIV/AIDS. Whatever happens in that field, they should monitor and look into the major developments happening through. So the key highlights of phase one was establishment of National AIDS Control Board, NACO, and respective states came up with state AIDS control societies. So every state they have their own AIDS control society. Now the implementation of large scale awareness generation camps started under NSAP phase one. They started licensing of blood banks and banning of professional donors, collaborations with NGOs and CBOs for prevention interventions among high risk groups. Now, uh, uh, what are high risk groups? So, uh, Government of India under the banner of NACO has identified certain population who are at risk of having uh, 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 suspicious behaviors. Though, so some of the identified high risk groups are uh, MSMs, or they can be truck drivers, migrant populations. So there are identified list of people who are at high risk group, high risk. Those are having high risk behaviors. So then one of the highlight of NSAP phase one was expansion of surveillance network. So as I stated in my first slide, those states who are having good surveillance networks, they are getting multiple cases. So their case fatality or case the prevalence of those cases are high in those states. So what are the achievements of NSAP phase one? This was way back in 97. We are done with NSAP phase one. So awareness level has increased significantly. So till before the launch of NSAP phase one, there was not much of awareness. So after NSAP phase one, the awareness regarding HIV/AIDS increased 70 to 80% in urban areas, even though the level of awareness in rural areas were less, which was up to about 30%. Now, modernization and strengthening of blood banks, as I said that they targeted certifications of blood banks, hence the services provided and the quality services provided by blood banks has increased. So they strengthened blood bank. Now, as I said that they started giving licensing system. So licensing system was introduced, and then they targeted professional donors also. So that was also one of the achievements. And then they focused on availability of good quality condoms. So if you will see, go into back in time, you will see social networking. So that was no very talked about thing. So through social networking, they started condom promotion, and then subsequently they took this to family planning also. So initially it started with condom promotion, which was targeted towards HIV/AIDS. Then slowly realized, oh, when condoms, social networking can work for HIV/AIDS, why not for family planning? So then, in after completion of phase one in 1997, government came up with NSAP phase one in 1999, and that was continued for 8 years until 2027. So, the first NSAP phase objective was to uh, improve awareness. Now, the second NSAP phase had an objective to reduce the spread of HIV infection through behavior change. So, in first thing, they targeted about increasing awareness. In second phase, they targeted behavior change, because HIV/AIDS is a behavioral problem. Because if people are having unsafe sex, so having unsafe sex is something which is related to behavior. That's how government thought of planning and targeting to a change in the behavior. So the strategies were focusing uh, from raising awareness to changing behavior. Then second one was prevention among high risk population. I already said government had identified list of high risk behavior people. And third one was to protect human rights by encouraging voluntary counseling and testing. So when I'm saying human right, there were cases where people had been, thrown out of the society. Kids of HIV positive people were not allowed in the school. So this was becoming a bit of problematic situation for the government. So multiple agencies came forward to support those people, and then government has to come up with certain legislative rules by which they try to protect the rights of these people. So the key highlights of NSAP phase 2 was launch and expansion of peer-led targeted intervention. So this was rolled out through NGOs and community-based organizations, establishments of VCTC and PPTCT. Now VCTC is Voluntary Counseling and Testing Center, and PPTCT is Prevention of Parent to Child Transmission. So introduction of antiretroviral therapy and establishment of ART centers, constitution of National Parliamentary Forum and National Council on AIDS, adaptation of National AIDS Prevention and Control Policy and National Blood Policy, and then capacity building of SACs and establishment of program monitoring unit. So one side, government established multiple agencies like National Parliamentary Forum and National Council on AIDS, so that they should cater to human right aspect. They came up with testing centers so that more and more people can be screened out. At the same time, to ensure to give treatment, they came up with ART centers, ARV centers, and they at the same time parallelly they targeted towards strengthening state AIDS control societies, so that they can monitor implementation of HIV/AIDS program or NACO programs in their own states. So what were the achievements of NSAP phase 1? So they came up with targeted interventions, no multiple targeted interventions. So these targeted interventions, again, when I'm saying targeted intervention, they were targeted towards high risk behavior people, condom promotion, or having linked ART, community ART, link workers, so that they can visit and they can check whether they are continuing medicines or not. So there were multiple targeted intervention which were rolled out through government, through NGOs by government. Now there were 875 voluntary counseling and testing centers, 679 clinics at district levels were set up. National wide and state level behavior sentinel surveillance surveys were conducted to understand the behavior of these HIV affected infected people, and then prevention of parent to child transmission program was expanded. So under NSAP phase 2, government realized that there is one way. Okay, before I go further, let's discuss about how HIV spreads. So there are basically four ways. First one is through unsafe sex. Second one is through no giving or transfusing infected blood. Third one is through intravenous drug uses, through needles and all. Fourth one is known as vertical transmission. So vertical transmission is something when a HIV infected mother gives birth to a child. So first three things you can, try to control or modify the behavior or increase awareness. So these things can be controlled. But fourth, that is vertical transmission, a mother is already affected. So how you are going to ensure spread of disease from mother to child? So they started this focus program, prevention of parent to child transmission, under which mother and child both were being put on ART, ARV drugs. So there are multiple things which you can further go and learn about. So under NSAP 2 only, National AIDS Prevention and Control Policy was launched in 2002, and Government of India approved this. So objective was to come up with zero transmission rate, prevent further spread of HIV/AIDS, improve services of people living with AIDS, no, to take care of people living with AIDS by protection of their rights, by proper care and support in the hospital and community, keeping those data safe and confidential, so that people should not know whether the person who is visiting that clinic is HIV AIDS or not. Proper counseling for HIV positive mothers. So these HIV positive mothers are being counseled at PPT-CT centers. Then clinical management of HIV AIDS. So these were certain objectives of National AIDS Prevention and Control Policy. So what are the components of the program? So there are basically six components. First one is condom promotion. Second one is control of sexually transmitted disease. Third one is to have a good surveillance system. Fourth one is to have a information, education, and counseling system. Fifth one is to target blood safety, to ensure the blood which is transfused is good. And then the last but not least is clinical management. So all other five components were targeted towards prevention, whereas clinical aspect is more about towards treatment. So all these six components were part of this National AIDS Prevention and Control Policy. So under blood safety, one government came up that only those blood banks will operate who are being given license by the government. And as I said that they were targeting these professional donors. Hence, government encouraged only voluntary blood donation, where they don't no they are not going to charge any money for donation of those bloods. Ensure safety in collection, processing, storage, and distribution of blood and blood products. So once when they are separating plasma, RBC, hemoglobin, so everything during separation, processing, handling, all the safe procedures has to be taken care. Establishment of zonal blood centers who are going to supervise respective blood centers below them, and testing every unit of blood for universal precaution like HIV, hepatitis, malaria, syphilis. This was being mandated, and if they are found to be having these infections, these blood unit has to be discarded. Under control of STDs, integrated services for treatment of reproductive tract infection and sexually transmitted disease. So with HIV/AIDS vertical, these uh, 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 diseases were also merged. So what were those? RTI, reproductive tract infection, and sexually transmitted infections. So they were merged under HIV. Training of all medical and paramedical workers engaged in providing STDs and RTI services, and early diagnosis and treatment of STDs is recognized as one of the major strategies to control spread of HIV infection. So those people who are found to have sexually transmitted disease like syphilis, gonorrhea, they were identified as high risk behavior people, and they were recognized as one of the strategies to cover those people, to treat those people having STDs and identify them as one of the strategies to control spread of HIV infection. So condom promotion, 85% of HIV infection happens just because of unprotected sex or having multiple partner, not faithful to their partner. So this can be the government thought of controlling no the spread of disease through ensuring availability of having good quality condoms. That's why you can see condom boxes at bus stop, at multiple public places, so that public can make use of those condoms, and then they should not indulge in unsafe sexual practices. So progress made by there has been quality control of condom, which was uh, rolled out by NACO, and these guidelines of having quality control of condom was set up by WHO, which was uh, recognized by government of India, and they started following those processes. As I said, social marketing for condom promotion was being done, and involvement of NGOs and private volunteer organizations in the program. PPTCT. So as I said, that vertical transmission is there. Under vertical transmission, there are three different phases where a HIV infected mother can pass on infection to the child. First one is during pregnancy, second one is during labor, third one is by breastfeeding. So altogether, 5 to 10 infants out of 100 will be infected during pregnancy. 20 infants will be infected during labor and delivery, and 20 to 30 infants will be infected during breastfeeding. So Government of India came up with a short course antiretroviral regimen which was being given to mother, and it can subsequently reduce the risk of perinatal transmission of HIV during pregnancy and childbirth to single digit. So if you will see above data, these are like almost 35% of the children are suspected to get HIV no virus if mother is not given any medicine. But when mother is being kept on antiretroviral therapy, this chances reduces from 35% to single digit. It is, which is almost, if I am correct, it comes to 5%. IEC, information, education, and communication, which is key to generating awareness on prevention, was one of the components under this. So this was used to increase the knowledge of general population, especially youth and women, on what is safe and safe sexual behaviors. And then IEC was focused to sustain behavior changes, which has been targeted toward NSAP phase 2, especially in high risk group people, and to ensure their treatment. And this IEC was also used to generate demand for care supported and transmission services. Someone is having any question? Okay. So HIV surveillance. Now government came up with surveillance services. So there were 5 surveillance systems which were identified under this program. One is sentinel surveillance, other is sero surveillance, AIDS cases surveillance, STD surveillance, and behavior surveillance. So these were different surveillance systems which were being used for HIV surveillance by the government of India to look for cases. So now, what is ICTC center? So most of the places where deliveries are happening, they are having a ICTC center. So this is integrated counseling and testing centers, which are across India. So at the as the name suggested, these are the places where all identified pregnant women are supposed to go and get tested for HIV. No, and they are supposed to visit there with their partners, but unfortunately, partners or like husbands are not forced and they are not made mandatory. Whereas these females has to undergo this test because they have, if they have to be delivered in that hospital, the health professional will always ask for that no test reports. So they by default they have to undergo this testing test services. So we will come to NSAP phase 3, which was launched in 2000. The objective was to reduce the rate of incidence by 60% in first year of the program in high prevalence states, and then 40% in vulnerable states. So government of India has identified certain states as high prevalence states and some states as a vulnerable state. So the strategies were prevention of new risk infections, new infections in high risk population, providing greater care and support and treatment to people living with HIV/AIDS, to strengthen national-wide strategic information and management system. And fourth one is prophylactic treatment of HIV. So key highlights of no, NSAP phase 3 of ANC services, transition of donor funded intervention for the key population, establishment of CMU at NACO and SACS, and program management, decentralization of program management up to the district level. Okay. Can anyone let me know what is CMU? There is something written over here, SIMU. Can anyone tell me what is SIMU? SIMU. Am I audible?
No idea, sir. Please tell
Okay.
us.
So if you have no idea, please feel free to ask. This was just a question to cross check whether you guys are listening or not. So SIMU is a Strategic Information Management Unit. So basically, these are being established at a state levels to have all the data on HIV positive cases where they are. Okay, so this was established at NACO and SEX. So centrally also there was a data monitoring unit, and at this state level also there were these were these strategic information management units who were looking into the data. Okay. Now, at a state level, there were a state AIDS control society. Now, district came up with DAPCO, District AIDS Prevention Control Unit. So, till phase 2, there was NACO, there was SACS. In phase 3, they came up with DAPCO, which was District AIDS Prevention Control Unit. So the HIV, what were the achievements? So 306 fully functional ART centers, 6012 linked ART centers, 10 center of excellence. So government of India across India has identified certain medical colleges who were having link ART centers as center of excellences. So some of the faculties of these no medical colleges, they were providing technical support to the government, through capacity building or coming up with operational guidelines and all. So they were identified as center of excellence. Then 12.5 lakh PLHIVs has been registered by NSAP phase 3, and by phase 3 there were 2 lakh patients who were alive and were on ART treatment. Link workers training module were updated, condom promotion program was further strengthened, and then red ribbon clubs were established across India. Then NSAP phase 4 came up, right? What were red ribbon club? What was red ribbon club? Anyone? Any idea?
I think it's a movement to spread awareness about HIV and AIDS,
Very good. So
celebrating.
this was a movement which was started by government of India, no, especially in schools and colleges to spread awareness on HIV. Right. So these students were enrolled in these, and then on national AIDS day, there had been multiple talks, awareness sessions across, government departments or school colleges were being held regularly at regular interval to sensitize them what is HIV/AIDS. So okay. So under NSAP phase 4, government targeted to reduce new infection by 50%, and 50% of what was actually the baseline of 2007, which was NSAP phase 3. So to provide comprehensive care and support to all persons living with HIV and treatment services for all those who require that. The key strategies were intensifying and consolidating prevention services, comprehensive care support and treatment, expanding of IEC services further, then strengthening institutional capacities, strategic information management system. So under NICP phase 4, what were the key highlights? The changes in funding landscape with government of India. So before NICP 3, you will see the funding was more towards funding agency. So after NICP 3, the funding of government of India for national AIDS program was enhanced, and it has gone up to 73%. So only 27% was being through some or the other donor agencies. So one of the major donor agencies for HIV/AIDS in India till date is uh, Global Fund.
Uh,
So Global Fund is one of the agencies which is funding in India on AIDS, TB, and malaria. So one of the biggest funding agency is Global Fund. So the government of India under NSAP 4 came up with toll-free helpline number, which is 1097, adoption of dual elimination of vertical transmission. Now, I have already discussed what is vertical transmission. So when I am saying dual vertical transmission, this was HIV/AIDS and syphilis under NSCP guidelines. So launch of NSCP intervention, they enhanced the services to prisons also, where they identified this also as one of the high risk group behavior people. The strategic expansion to reach out to HIV screening services through ICTC integrated counseling and testing centers. CD4 cutout level for initiation of ART was shifted. So there is something called no CD4 count. So this is one of the markers of HIV. So previously to start HIV/AIDS for ART was something else. So again that cutoff was reduced to 500. No, the cutoff rate for CD4 count. And then midterm review of NSAP phase 4 was being done, which was not done in the previous phases of NSAP. So key highlights of NSAP phase 4 extension was enactment of HIV and AIDS Act 2017. So this is a government act under which there are some punishable offences. Launch and scale up of test and treat policy for HIV patients. Mission Sampark to bring back lost to follow up. So this was the era when government of India came up with a peculiar problem that there were multiple cases, but all of a sudden, whether they vanished or they stopped coming to uh, treatment centers for taking medicine, and this became a cause of concern for government because they were infectious. If they will not go and take a medicine, and if they are still indulged in high risk behavior, they will keep spreading the disease. So they started following up those patients, and then they realized they changed their identity. They went to a separate hospital where they started taking medicine. So this was the phase when they started giving unique identification number to these patients and started linking those patients with Aadhaar. So that's how this whole menace was being solved. Everyone has to be mandatorily enrolled with Aadhaar numbers so that they can trace those patients, and then they be ensured that if okay, this patient is not taking medicine from Delhi, okay, no problem, they are taking medicine in Noida, okay, no problem, they are taking medicine in Gurgaon or Faridabad. So that's how the program management unit sitting at the central level, they can see with their database, okay, if they are not taking medicine from here, they are getting medicine from there. So all these trackings has been done. So, okay. So the key highlights of NSAP Phase 4 extension was a strategic information expansion into newer areas like pre-exposure prophylaxis. Now, let me explain this in a little detail. Suppose while withdrawing samples from a person who is HIV suspected, is someone trying to say something? Okay. So while withdrawing sample from a HIV infected or affected people, the lab technician gets a prick. What he will do? So they were supposed to be put on exposure prophylaxis. They were supposed to be prophylactic treatment has to be given. So the guidelines regarding those things came over, and then they started population size estimation of high risk groups and people living with HIV up to the district level, development and rollout of uh, client centric IT enabled monitoring, evaluation and surveillance system with embedded supply chain system, third party evaluation of NSAP 4 extension, and successful mitigation of COVID-4 pandemic. So during COVID, again, these patients were not turning up to take medicine. So they started reaching out to those patients and then providing medicine. So this was again something which is which has to be you can refer documents and learn in detail. This is not a part of your syllabus, but you can learn how Government of India has meticulously worked during COVID to ensure that the HIV patient should continue taking their ART medicine during COVID phases. So NICP phase 5 aims to reduce annual new HIV infection and AIDS related mortalities by 80% by 2025-26 from the baseline value of 2010. NSAP Phase 5 also aims to attain dual elimination of vertical transmission, elimination of HIV/AIDS related stigma while promoting universal access to quality STI/RTI services and to at-risk and vulnerable population. So there are 5 goals under NSAP 5. So to reduce annual new HIV infection by 80%, already stated. To reduce AIDS-related mortalities by 80%, eliminate vertical transmission of HIV and syphilis, which was envisaged in NSAP 4 extension, which never happened. Promote universal access to quality STI/RTI services, and to eliminate HIV/AIDS related stigma and discrimination, which is happening again and again. Somehow it has been never ruled out. So, Government of India in 2017 came up with HIV/AIDS and Prevention Control Act. As I already said, that this is a rule under this is a rule of land. So, Government of India came up with this rule under which they ensure employment, educational establishments, and healthcare services for these people. And these include, if they are not supposed to being denied or terminated or discontinued or any unfair treatment to HIV infected or affected people in their employment, in any educational establishment, in healthcare services, while giving a house or renting a property, or standing for public or private offices, or in any provision of insurance schemes. So they should not be given any unfair treatment. So the guiding principles of NSAP Phase 5 are uh, to keep beneficiary and community in the center, break silos and build synergies within the community. So these people living with HIV/AIDS should not be living in silos. A strategic information-driven system, leveraging technology and innovations, high impact program management and review, integrate gender services and responses, enhance and harness partnership, and continue fostering and technical agreements, arrangements, and institutions. Okay, so I think I am done with the slides. So this was all about NSAP, National AIDS Control Program, under which we learned about NSAP Phase 1 to NSAP Phase 5, how it is started, with public awareness to control that disease, and then they started taking care of human right aspect, legal issues, and then ensuring the prophylactic treatment of those patients across the program. So, you guys are having any questions? Okay. So if you are not having any questions, I will be passing on the slides to Seema, and she will be sharing. If I'm right, the vector-borne control program slides are also to be shared. So I will be sharing with her in a multiple of days, and then she will be sharing it further with you. So if no one is having any question, I am closing the session. Thank you.